Well, hello everyone. Welcome to the HUB&Spoke webinar series. Today's webinar is part of the Leading Digital Transformation series. I'm Kim Crider, and I'm going to be your host for today. I'm a partner at velocityHUB. Our webinar today is co-sponsored by Signature Consultants, the national leader in IT staffing. It's my pleasure today to introduce you to our special guest, Dr. Fickenscher. Kevin is the Director of Biomedical Innovation and Healthcare Strategy at the MITRE Corporation. He's also a leadership coach and an author, and you can see that he's written the book there, Toto's Reflections, The Leadership Lessons from the Wizard of Oz. Which is quite appropriate for what we're going to be talking about today as we delve into what's been happening in the world of healthcare. In this transformation series, we've really been looking at how digital technologies have been enabling organizations across all industries to transform themselves, to create new opportunities for customers, patients, clients, in this care, healthcare providers. We've talked about how digital technologies have enhanced operational processes and really enabled businesses, both for-profit and non-profit, to increase value for themselves. So Kevin, it is a real pleasure to have you here with us today to talk to us about what's happening in the world of healthcare and how healthcare is trying to take advantage of digital technologies. As we get into it today, we look forward to your insights from both a technology perspective and industry perspective, as well as the perspective of leaders and the role of leaders in facilitating healthcare transformation. So with that, I see that you're getting ready to bring your slides up for all of us. Kevin, I know you've got quite a background in healthcare, being a medical doctor yourself, as well as a systems engineer and the Director of Biomedical Innovation and Healthcare Strategy at the MITRE Corporation. So as you go through this, I do appreciate it if you would take a few minutes and give us some of that historical perspective as to how we got here with regards to digital transformation and how healthcare is continuing to evolve.
My pleasure. And for some reason, I don't know why.
Do you see the slide show little button at the bottom of your screen?
No. Oh, there. Is that it?
That's perfect.
Okay, there we go. Sorry about that, Kim.
No worries.
Technology, can't live with it, can't live without it.
That's it.
So anyway, so it's a real pleasure to be here today to have this opportunity to talk with you a little bit about digital transformation, which I think is fundamentally changing our whole notion of society. What I'd like to do is go through what I think are some of the major forces that are precipitating change in American healthcare, and how technology and transformation fit into that, and how they serve as really a disintermediating force that is dramatically changing our whole notion of care, how it's delivered, where it's delivered, and who's delivering it. I go back to Mahatma Gandhi, who said, "You must be the change you want to see in the world." And I really think that one of the things that we need to be thinking about in healthcare is that, much like other industries, we're on the verge of some very, very dramatic changes. And we need leaders in healthcare to step up and say, you know, there is a better way. We can do a better job. We can provide safer healthcare. And that can be done in a world that will include the transformation that we're talking about. You know, I like to think about the history of transformations that have occurred in the world. And if you go back and look at history, you know, we had the Neolithic revolution, which occurred about 15, 20,000 years ago, where we moved from nomadic lifestyle to living in communities. And that caused a fairly significant upheaval. There's not a lot written about it, and it's all been done from archaeology, but we have discovered that societies began to develop at that particular point. But more recently, if we go back to the mid-1700s, late 1700s through the 1800s, we had a massive change in society through the Industrial Revolution. And it occurred over a period of 70 to 90 years, depending upon where you lived. And each of these revolutions, if you will, caused an increase in material wealth. They caused an extension of life of individuals. They resulted in very significant disruption of the social structure of societies. They created communities and all sorts of new organizational forms. And if we go back to the 1880s, it was a time when there was lots of unrest. In the United States, as an example, people were having to move from the farm into the city. I just read a statistic the other day where there were at one point in one particular steel mill, there were 11,000 workers, and today there are 100. And yet the productivity of that steel mill is the same as it was when there were 11,000 people. Imagine that.
Yeah.
That same thing happened on the farms. My relatives, all of my relatives were farmers in Nebraska and North Dakota. And we had these little small farms, and now they're big, massive farms, and they don't require as many people. And we use huge tractors and all that kind of stuff. So there is a revolution going on, and I would submit to you that we are in the midst, we're at the formative stages of an information revolution. What's interesting about that is while the Neolithic Revolution took thousands of years, and the Industrial Revolution took hundreds of years, the information revolution is occurring over decades. And so we're seeing a dramatic shortening of the amount of time that is causing the same type of disruptive patterns in society. And so as a result of those kinds of changes, we are disintermediating society. And I think that that's fundamentally what we're experiencing here in the United States here in the last year or so, as we've had lots of discussions. So what does that mean for healthcare? Will healthcare change? Well, I would submit to you that if we look at manufacturing, if we look at logistics, if we look at news media, if we look at travel, if we look at aviation, I think it's pretty clear that all of those industries have changed in some very significant ways. I mean, who would have predicted 10 years ago that Amazon would be the company that it is today? Or that we would get most of our information on the web rather than pulling out the newspaper? Or that aviation would be looking at, hasn't done it yet, but would be looking at the possibility of pilotless planes. Imagine that. So is healthcare going to change? I think so. I really do. I think we're on the verge of some very dramatic changes. And in fact, healthcare must change, would be my argument. Let me give you some data to support that. If we look at what society wants really high quality healthcare. Matter of fact, they don't want high quality healthcare. They want perfect healthcare. They don't want anything to go wrong with them. They want it right now, and they want it for low cost, free. It would be nice if you could do it for free. So those are the demands that society is placing out there, and that is causing lots of difficulty within the healthcare community. At the same time, we're moving from an information theocracy. Oh, I'm Dr. Fickenscher. I went to medical school. I graduated and I did a really good job. To, oh, Dr. Fickenscher, I looked you up on the web last night. I discovered that you're in the bottom quartile of all physicians who provide that particular service. Dr. Fickenscher, it says here that you have a number of mistakes that you've made over the last year. Why would I let you touch me? That is the kind of environment that we're facing. We're moving towards an information democracy. And so I would submit to you that that kind of change is causing disruption. And why is that occurring? Well, it's occurring because of economics, globalization, where we've got countries that are competing with one another, and there's not enough resources. As a matter of fact, if you look at the federal budget, close to 50% of it is devoted to things like healthcare and Social Security. Those are the two dominant areas. In state governments, healthcare is the number one cost bucket of state budgets, and that's causing stresses. We've got another issue, which is the fact that we have a boomer population, not just in the United States, but in Europe. China even has a bigger problem than all of us, in that there are not enough young people to take care of all the older people. So we've got this bulge that's coming through, and the bulge demands a lot of healthcare services. Not only that, but the people that provide the care are of the same age group. So if we look at the average age of nursing in the United States, it's 55 years.
Wow.
That's significant. That's significant. So over the next 7 years, get this statistic, next 7 years, 1/3 of all the primary care physicians in the United States will either retire, become disabled, or die. 1/3.
Wow.
There's no way that we can start up enough medical schools. There's no way we can shift enough people into residency programs. There's no way we can take a nursing cohort of 55, average age of 55, and convert them into providers. There's just not enough time to do that. So the issue is we need to be thinking about new ways of doing things. That's very clear. And we're being affected by things like genomics, personalized medicine. The internet has clearly affected everybody, and that's clearly what we're talking about. And then there's people's expectations. I mean, the fact of the matter is that there is a difference between McDonald's and Ruth Chris. There is a difference between a Lexus and a Chevy. And people are much more discriminating about the services that they purchase, and they're getting this to be the same way in healthcare. So this is simply a statistic that I wanted to throw out there, which is if you get on an airplane today, your chance of dying in an accident is like 1 in 65, 67 million, something like that. In healthcare, we have the equivalent of a 747 jet crashing every day. Now, the issue is, would you rather go fly on United Airlines, or would you rather go to the emergency room tonight? You know, and it's like, it's a no-brainer for me. I get on airplanes every week. You know, I don't go to emergency rooms. And what I'm pointing out here is that the rate of infections, iatrogenic diseases that are caused is very high, and that's a significant problem. So we also have, so safety is an issue. We also have a significant amount of waste, administrative complexity, excessive prices, there's fraud and abuse in the system. So all of these areas contribute to cost structures that require us to look at different kinds of approaches. And there we go. And wants to go. Okay, there we go. And this simply points out the fact that we have a significant amount of dollars being allocated to the mandatory spending of healthcare. So mandatory spending, which is, you know, healthcare and Social Security. So Social Security, Medicare, Medicaid, the biggest components, which I already talked about. So in essence, you know, I would argue that we have a burning platform, and that we're going to see consolidation. I mean, almost every week you can open up the newspaper, particularly in the healthcare literature, and you'll find that there's another merger going on. It requires effectiveness and efficiency. Productivity is really in demand. We're seeing globalization of services. I mean, there's a number of healthcare institutions now that globalize by providing radiology services at night, not using radiologists in the United States, but using backup from India or wherever. So we're seeing globalization of services as well. All of these issues are really disintermediating the entire approach that we take to healthcare. And I would argue that technology is not the problem. What it is a problem of process. It's a problem of roles and responsibilities. It's a problem of governance. And we need to be thinking about that. So,
Kevin, can I just interrupt you for a minute? We have a question from our audience. Can you just, you may have said this earlier, but the audience member is asking, how do you define disintermediation?
Disintermediation is really the taking apart, if you will, of the traditional approaches of how we deliver care. So let me try to use a very specific example. So in today's environment, in a fee-for-service world, a patient comes to my office, I provide a specific service, and I refer them to another physician, or I take care of them. I send them to the pharmacy. The pharmacy then fills a script, and the script gets, and then the patient goes home, takes the medication, etc. So everybody has their little piece of action. And that's is all structured. It's structured around licensure. It's structured around the way we do our process. It's structured around the way our insurance is organized, et cetera. Well, all of a sudden, we're now going into a value-based management system where instead of having a fee-for-service type structure, we're giving a bolus of money to an organization and say, take care of these people. And in that kind of a situation, what happens is that, well, maybe it's not efficient for me to simply write out a script and send them over to the pharmacy. Maybe I should have those medications in my office. Maybe rather than having to call up the insurance company and get procedures approved on a piecemeal basis, maybe I will have all those approvals pre-organized based on a protocol, based on a guideline. So that disintermediates the traditions, the way we traditionally deliver services. And in fact, maybe I won't even have a physician see the patient. Maybe I'll have a nurse practitioner or a physician assistant see that patient, because it's really a primary care issue that they can manage and handle on their own under my supervision or in consultation with me. So that's what I mean when I say disintermediation. We're taking apart the way we've traditionally done things for hundreds of years and now doing it in an entirely different way. Make sense?
Maybe, absolutely. And so maybe you'll offer telecare, right? Which is the next thing.
Absolutely. So I would argue that telecare is a disintermediating force, and that in fact with telecare, we're going to see a lot of changes begin to occur. Now, I want to offer a definition, because I think there's a lot of confusion, I think, in the field. A lot of people lump everything into telemedicine. Well, I think of telemedicine as being the interaction that occurs between a physician and a patient. So if I get involved in using, for example, this kind of technology where and let's assume, Kim, that you're my patient, I'm talking to you live and we're having this discussion. And I say, well, Kim, I think you should do X, Y, and Z. And that's the relationship. It's a telemedicine relationship. Telehealth, on the other hand, is where you have a Fitbit on your wrist and you're monitoring, whatever your exercise program, or perhaps you've got a glucose monitor and you're monitoring your glucose level because you've got diabetes, something like that. Telecare is very different in that it's using technology to actually deliver care in the home, deliver care in the institution without the intervention of an individual. So what do I mean by that? Well, so for example, congestive heart failure, I think, is one of my favorite examples, partly because congestive heart failure represents 20% of the admissions in the United States. It's a massive issue. So congestive heart failure patients generally start to go into congestive heart failure about 96 hours before they show up in the emergency room. Now, how do we know that? Well, they start to gain weight, they start to get short of breath, they start having difficulty moving around the house, et cetera, et cetera. So how do we capture that? Well, if every day you had a patient get up and the first thing they did when they got out of bed is weigh themselves, and if every day you took their blood pressure, and which you can now do by taking a little device and literally squeezing it and holding it for 10 seconds, not only do you capture their blood pressure, but you can also capture a 1 lead EKG. You can also put your finger into a little finger stick, soon to be just monitoring your sweat, and you can get your electrolytes done.
Wow.
So there's lots of little things like that that you can do to have a patient who has congestive heart failure literally go through a series of protocol-driven activities first thing when they get up in the morning and determine whether or not somebody's going into congestive heart failure. And when they are, the nurse calls up and says, hey, Joe, you got to take some more diuretics today. And Joe says, oh, okay. And so he takes his diuretics, his extra diuretics, and he, diureses, and he doesn't go into congestive heart failure. He doesn't use the emergency room. His cost of care is at least $10,000, $15,000 less than it would have been otherwise.
Wow.
That is telecare. And that's just a simple example. What's interesting, for example, is that the Department of Defense, as an example, is looking at actually delivering care to trauma patients in the field. That's how sophisticated this is becoming. So I would argue that we need to be clear and that there is a difference between telemedicine, telehealth, and telecare. And that telecare, from my perspective, is also going to be more than just the chronic care that I just mentioned. around congestive heart failure. Let me give you another example of telecare that I'm actually very excited about, that I refer to as augmented clinical intelligence. Well, what do I mean by that? Well, I'm aware of a researcher who's done a lot of really fascinating work where she's a linguist, and over the last couple of years, she has captured the interviewing of patients with PTSD, and she's captured that information on an audio basis, and she's done it with experts who are clinicians, experts who are interviewing the patient. And what she's been able to do is she has taught a computer how to diagnose PTSD based on the conversation, the words that are used, the nuance, the tempo of words, the push of the words, all of the inflections of the words. And this is just the audio. It's not including any video. To the point where more recently, the computer has gotten as good as the computer has gotten as good as the expert in diagnosing PTSD, and better at predicting somebody who's at risk of suicide. Amazing. Now, so that's exciting in and of itself with PTSD. But imagine if we had that kind of a device, and I had it, listening in the conversation that I was having with the patient who was coming in with their back pain. And I go out of the room and the device says to me, "Dr. Fickenscher, did you think about depression?" Oh, good thought. Good thought. I should go back in and ask a couple more questions. And in fact, maybe it is depression. Or, "Dr. Fickenscher, based on the cadence and the conversation and the words that were used and how the words were expressed, have you thought about Parkinson's disease, early stage Parkinson's disease?" Oh, that makes a lot of sense. That's clinically augmented intelligence. I would argue that that's the kind of technology that's going to be useful. And in fact, that's when we're going to see the computer become the physician's next stethoscope. And it's going to be
right?
The next stethoscope.
Still has to apply his judgment, his or her judgment.
Absolutely. Matter of fact, that's the reason I think I really don't think that we're going to see technology replace physicians or nurses or pharmacists. I think it's going to augment their abilities, just like the stethoscope did 150, 200 years ago, probably now 300 years ago. So, here's an interesting quote from Florence Nightingale, 1863. "In attempting to arrive at the truth, I have applied information everywhere," but I can't quite see it here. Just a second. There you go. "But scarcely an instance have I been able to obtain medical records fit for any purpose of comparison." Imagine, 1863, we got the same problem, and it's 2017. So the issue is, what do we need to do about that? Well, the number one issue that I think that needs to be dealt with in healthcare that is being processed is interoperability. We have all these proprietary systems that don't talk to one another. There is a lot of recognition now within the healthcare industry that having that kind of environment doesn't work, that we need to have interoperability. So I think you're going to see a lot of focus on that over the next couple of years. And after interoperability, once you have that in place, is the ability to create transparency, so that what's being done at one institution can be compared to another institution, or one doctor to another doctor. The third thing that needs to happen is we need to have a standard health record. And in fact, when you look around the world, what's interesting is that this is a really interesting slide, because you look at the per capita cost, and as I've already pointed out, the United States is at the top of the list. And this is the OECD's, by the way, the economically developed countries. And you see that at the top is the United Kingdom, Switzerland, Sweden, Australia, all countries, along with Germany, Netherlands, New Zealand, that have a standard health record. In other words, they've defined that there is a standard piece of information that should be available on every single patient. The United States is at the bottom. So standard health record is another initiative that I think is required.
Kevin, question has come up from the audience. Why has the United States not been unable to have a standard health record?
Good question. Well, it is because in the United States, we have a philosophy that this will be solved by industry.
Mm.
And, we've left it to industry to come up with a solution. And in fact, because of the competition, because we haven't had an industry that, unlike automotive, where we do have standardization, I mean, around mufflers and, tires and, all this stuff, gasoline that we use inside of our cars, all that stuff is standardized. In healthcare, we haven't had that because we haven't had these large healthcare organizations that really demanded it because of efficiency and the need for productivity. Because of consolidation, because of the requirements for efficiency, because we have spent billions of dollars on creating electronic health record systems that don't talk to one another. And we now recognize, because we have them in place, that it's important to be able to talk to one another. That's why we're seeing the move now. And I think that it's coming from industry pushing and saying, hey, we got to have this. So I think that's a large reason why. I mean, some places like, the UK as an example have mandated it from a government standpoint. That's just culturally not been the style of the United States. I mean, that's been our history. That's the way it works. So we're in some ways, when it comes to mandated structures, we're maybe latecomers, but ultimately we do well. So but this is going to cause radical change, radical transformation for our industry over the next couple of years. I think the other thing that's happening is that the move towards value-based reimbursement is forcing the issue. It's no longer about Dr. Fickenscher, seeing patients in his office. It's about the value and the value that the team brings in providing care. And it's also about really driving, as we think about it, towards population health, which is a focus on healthier communities rather than just collecting information and data. And if you want to have healthier communities, you can't just look at medical information. You have to look at other kinds of information. You have to look at housing information. You have to look at care services that are provided in the community, home care. You have to integrate all these different pieces of information, and that can only be done if you have an interoperable standard model in place. So in essence, what I would argue, Kim, is that we're moving from an old world where everything was based on the hospital to a new world where a lot of care is going to be delivered in your living room. And I really do think that that's kind of where we're headed. And then finally, I think that this is going to require that we rethink our whole process of education. I was actually on the phone this morning with a major medical school in the United States, talking with them about how they're looking at their curriculum and trying to think through how do they incorporate virtualist type training as part of their curriculum. Because I argue that the types of skills that you need to have, the types of capabilities, the way you synthesize information is slightly different if you're looking at a virtual world than if you're looking at somebody face to face and you're actually touching them. And the sensitivities that are required are very important, and we need to teach those skills to the physicians and the nurses and the other support personnel that are coming along, so that we can actually create what I call the healthcare virtualist, which is the clinician who actually applies virtual healthcare and supports individuals using things like what I was describing earlier for congestive heart failure, or even for problems like PTSD or Parkinson's disease or depression. And then finally, it's clearly there's a need for a focus on governance and process. Does the right hand know what the left hand's doing? And I think that that's going to be very important as well. So, the imperatives from my standpoint are that if we're facing a transformation, it's important for leaders to act now, because if you don't act now, chances are you will be run over by the transformation. I mean, my relatives lost their farm. We lost our farm because we didn't have the latest technology. We didn't incorporate the latest practices. So we had to get into other kinds of things. Same thing happens in healthcare. So the tools are available. I think the tools are out there. The question is, are we ready to adapt them? Are we ready to use them? And I would argue that the missing ingredient for using those tools has been leadership. And so why I'm excited about this opportunity, Kim, is to be able to talk to individuals who are leaders and say, hey, you know, you have a very, very important role in helping your organizations get ready for this transformation. And in fact, leaders need to explain the why. If you go to YouTube and you type on Simon Sinek, S-I-N-E-K, he has the video why. It's an outstanding video. Leaders need to be thinking about that because it is the why that will motivate people to make the changes that need to occur.
Yeah.
So that's my thoughts for today, Kim.
And I think you've made that argument really well. Just a few more questions that I see here from the audience. So with regards to leadership, and I appreciate you, kind of ending on that note. So there's doctors and healthcare providers, and you've talked a bit about what they need to do and how they need to evolve, and some advances in training and education that needs to occur. What would you say to healthcare administrators, and what would you say to IT leaders? What is their role from a leadership perspective in helping to guide these organizations into the future? I mean, yes, they need to be able to articulate the why, but beyond that, what would be the next steps?
So the next steps from my perspective are that I think too often, it's been my experience that you have professionals in the healthcare field that are very siloed. They're very expert in what they do, and they don't know how to walk the bridge to the other areas. And that it's really important in today's world, in a transformational world, to have a much more holistic view of the environment that we live in. So it's important for leaders of healthcare systems to become much more sophisticated in understanding information technology. So for example, I was recently having a discussion with an individual who's the leader of a major healthcare system about open digital health platforms. And it was very clear as we got into the conversation that he really didn't have a depth of knowledge around that notion of what's an open digital health platform, how does that work? So I realized that we had to back up, and I had to explain it in ways to bring him along so that he could walk over that bridge. In the same way, I would argue that many of my tech friends start to talk techie stuff, and they start doing their deep dives. They go down and they don't need oxygen, and they go down real deep. They don't come back for hours. And that just doesn't make sense to somebody who's over in administration. So having the tech people learn how to walk the bridge the other direction is equally important. And having physicians, that was my argument that I just made about physicians, that they need to understand how to use this technology so that they can become effective virtualists. It is walking the bridge. So I would argue that that's one of the key factors that has been missing and that is important in a very transformational world.
Yeah, that's great. So I think it sounds like what is needed is the ability to think strategically, the ability to think innovatively, the ability to be open to what are the opportunities that are out there, and have a curiosity and a willingness to learn and to understand them. At the same time, there's the need for leaders to be able to ensure that they themselves and their staffs are effective communicators, collaborators, in their ability to work across those various functional lines between administration, healthcare provider, IT, so that everybody can come together and understand that this is where we're going, this is why we're going there, this is how we're going to get there.
Absolutely. And I would argue one other point, Kim, which feeds on everything you just said, which is an understanding that it is all about the process of how you do the work, and that they need to rethink how they do their work. And unfortunately, too frequently, what I've seen in healthcare is that we layer on top of existing work and new ways of doing things and new technologies, and we don't rethink the whole process of how. And as a result, we get lots of frustration. So, it is also recognizing that we need to change the how, and that's okay. That's okay.
Yeah, That's great. Here's another question from the audience.
Yeah.
Tell us for a minute, tell us a little bit about your book, Toto's Reflections.
Toto's Reflections. So one of the things I have been a fan of is the whole question. I consider myself to be a student of leadership. And I think that, I've read all these leadership books and they're very dense and they get into all sorts of details and it's all very intellectual and good. And I started thinking about it and I realized that embodied in the story of Oz is this whole series of lessons around leadership. That in fact, it does take a brain. It does take the notion that you have to have heart. You do have to have courage. And so I've got within the Toto's Reflections a whole series of different lessons that come from the story. And so those are basically what it's all about. I won't tell you too much because I want people to go out and consider buying the book, but I frame it in the context of the story. And the reason I did that, Kim, is that in my experience, people have a much easier time remembering stories than they do remembering details and data and all of that. So if you can get people to understand the story and any part of the story, they will go, oh yeah, I know what that piece of leadership is all about. And so that's what the essence of Toto's Reflections, the Leadership Lessons of the Wizard of Oz is all about.
I love it. I love it. I'm going to go out and get that book, and I'm sure many of our audience members will as well. Yeah. Dr. Kevin Fickenscher, this has been an amazing event today, and you've told us some great stories. You've told us the story of the evolution of healthcare and how it's been transformed, how it's been disintermediated. And you've told us about the causes that are driving that, the forces that are driving that. You've told us about the implications of that and how leaders need to be able to respond. So you've really given us some fascinating insights about how to address a very important and critical and complex need that every individual has and that our country has. Because as you point out, the costs of healthcare continue to rise, the need for healthcare continues to rise, the demographics alone are driving this critical need. So thank you so much for sharing your insights with us here. Thank you for the work that you do as a researcher for the MITRE Corporation. Thank you for your heartened commitment to this effort and to this work as a doctor, a medical doctor yourself. We really do. We really are honored and privileged to have you here today. Let me just take a minute for our audience members out there today to remind you that our upcoming webinar is also going to be a fascinating one with some great stories from Brian Shield, the Vice President of IT at the Boston Red Sox. The webinar will be this coming Wednesday, the 8th of February from 1 to 2 p.m. Eastern Time. And this particular webinar is going to be live streamed from Fenway Park. So I will be at Fenway Park side by side with my friend Brian Shield, and we will talk about the digital transformation of baseball. And again, from a leadership perspective, what every leader needs to know about having a data strategy and the importance of data analytics. Brian will share his stories about how data analytics have been critical to baseball historically, as well as in current day in enhancing fans' experience in coming to the ballpark and being a part of their favorite team, as well as in enhancing the performance of the team and the players and their ability to continue to win. So you'll get some insights on Red Sox Nation live from Fenway Park with Brian Shield. And let me again say thank you to our sponsor, Signature Consultants, the national leader in IT staffing. Thank you to our audience members that participated today. And let me just remind you, leadership is a daily decision. It's something that has to be thought about every single day. Each of you have the opportunity to create amazing change in your organizations and amazing opportunities for your organizations and the organizations that they serve. If you have any questions or you want any assistance in advancing your leadership skills and advancing the digital transformation of your organization, give me a call, contact me. You've got my website information, you've got my email information right there. We will contact you back right away. Myself, I'll reach out to Kevin Fickenscher if you've got questions about healthcare transformation, leadership lessons from Toto, leadership coaching. We are here to assist you in any of your needs. And with that, I want to say thank you so much. Enjoy the rest of your day, and we look forward to seeing you at Fenway Park. Goodbye, everyone.